Welcome to another episode from the Veterinary Research Channel. Today we're diving into a fascinating study that could help veterinarians better predict outcomes for dogs battling Canine Parvovirus, or CPV. This potentially deadly virus is a major concern, especially in young dogs, and being able to identify those at highest risk early on can make a huge difference. The study, which was recently published in the Journal of Veterinary Internal Medicine, takes a look at simple blood tests that might act as early warning signs. Specifically, it investigates the utility of ratios derived from complete blood counts, or CBCs, which are routinely performed in veterinary practice. These ratios, called the Neutrophil-to-lymphocyte ratio, or NLR, Platelet-to-lymphocyte ratio, or PLR, and Monocyte-to-lymphocyte ratio, or MLR, have gained traction in both human and veterinary medicine as potential indicators of disease severity and prognosis. Background: in human medicine, the NLR and PLR have been studied extensively and found to be useful in predicting outcomes in various conditions, such as cancer, cardiovascular disease, pneumonia, sepsis, and even COVID-19. Veterinary medicine has also seen promising results with these ratios. For instance, the NLR has been shown to be a useful marker in puppies with acute diarrhea and in dogs and cats with acute pancreatitis. The PLR has been correlated with the duration of stay in the intensive care unit for dogs with severe hemorrhage, while both PLR and NLR have been associated with the severity of illness. Canine Parvovirus is a highly contagious virus that attacks the gastrointestinal tract, leading to severe symptoms like vomiting, diarrhea, and dehydration. In severe cases, it can cause sepsis and significant suppression of the immune system, making affected dogs extremely vulnerable. While aggressive inpatient treatment has improved survival rates, it often involves prolonged hospitalization and considerable expense. This is why identifying biomarkers that can predict hospitalization times and overall prognosis is crucial. This particular study was a retrospective, multi-center effort, meaning it looked back at data collected from multiple veterinary hospitals. The researchers analyzed the medical records of 401 dogs diagnosed with CPV between 2016 and 2023. These records came from 4 university teaching hospitals and 3 private hospitals, providing a broad and diverse dataset. To be included in the study, dogs had to have a confirmed CPV diagnosis based on a positive fecal antigen test and a complete blood count performed on the first day of hospitalization. The researchers then collected a range of data, including signalment, age, sex, and breed, blood cell counts, total neutrophil count, total monocyte count, total lymphocyte count, and total platelet count. Hematological ratios, NLR, MLR, and PLR, calculated from the blood cell counts. Duration of hospital stay. Outcome: whether the dog survived to discharge or not. The hematological ratios were calculated by dividing the total counts of specific white blood cells, or platelets, by the total lymphocyte count. Specifically, the NLR was calculated by dividing the total neutrophil count by the total lymphocyte count. The MLR was calculated by dividing the total monocyte count by the total lymphocyte count, and the PLR was calculated by dividing the total platelet count by the total lymphocyte count. Key findings: out of the 401 dogs, 336, or 83.8%, survived to discharge, while 65, or 16.2%, did not. The study revealed that the PLR was significantly higher in the dogs that did not survive compared to those that did. In fact, the median PLR in non-survivors was 336.56, while in survivors, it was 217.65. Statistical analysis confirmed this difference was significant. The researchers also used a receiver operating characteristic curve to assess how well the PLR could predict non-survival. The area under the curve was 0.615, with a cutoff of 700 showing a 21.5% sensitivity and 90% specificity for non-survival. This means that a PLR above 700 was fairly accurate in identifying dogs that were unlikely to survive, although it did miss a significant proportion of non-survivors. Interestingly, no association was found between the duration of hospitalization and any of the hematological ratios or total white blood cell counts. However, the lymphocyte count was significantly lower in non-survivors, while the monocyte count was higher. Interpreting the results. So what do these findings mean? The fact that a higher PLR was associated with a higher risk of death suggests that it could serve as a valuable prognostic marker in dogs with CPV. The PLR reflects the balance between inflammation, as indicated by platelet count, and the immune response, as indicated by lymphocyte count. In other words, An elevated PLR could indicate a heightened inflammatory state coupled with a weakened immune response, both of which are detrimental in CPV infection. The lower lymphocyte count in non-survivors aligns with previous research showing that lymphopenia, or a deficiency of lymphocytes, is a common hematological abnormality in CPV. This is likely due to the virus's affinity for lymphoid tissue, leading to its destruction, as well as the release of cortisol, a stress hormone that can suppress lymphocyte production. Limitations and considerations. It's important to note that this study, like all research, has certain limitations. First, its retrospective nature means that the researchers were limited to the data already available in medical records. This can introduce bias and make it difficult to control for all possible confounding factors. Second, the study was conducted across multiple centers, which could introduce variability in treatment protocols and diagnostic methods. While this can improve the generalizability of the findings, it also adds a layer of complexity. Another limitation is that blood smear evaluations were not performed in all cases, which could have provided additional information about the types of cells present and their morphology. Finally, the non-survivor group included dogs that died naturally and those that were euthanized, which could have influenced the results. The bigger picture. Despite these limitations, this study provides valuable insights into the potential of hematological ratios as prognostic tools in canine parvovirus. The finding that a higher PLR is associated with a worse outcome suggests that this simple blood test could help veterinarians identify dogs at higher risk and tailor their treatment strategies accordingly. However, it's important to remember that the PLR is just one piece of the puzzle. It should be interpreted in conjunction with other clinical signs, laboratory findings, and the dog's overall condition. Further research is needed to validate these findings and determine the optimal cutoff values for PLR in predicting outcomes in CPV. The study highlights the importance of monitoring lymphocyte counts in dogs with CPV. Lymphopenia is a well-established indicator of disease severity, and maintaining lymphocyte counts may improve outcomes. The researchers also found that monocyte counts were higher in non-survivors. Monocytes are a type of white blood cell that plays a role in the inflammatory response. An elevated monocyte count could indicate an imbalance between the body's inflammatory and anti-inflammatory responses, which is often seen in sepsis. Clinical significance. This study suggests that the PLR, in conjunction with other clinical and laboratory findings, can help veterinarians make more informed decisions about treatment and prognosis in dogs with CPV. By identifying high-risk patients early on, veterinarians can intensify treatment efforts, discuss realistic expectations with owners, and potentially improve outcomes. While further research is needed, this study adds to the growing body of evidence supporting the use of hematological ratios as valuable tools in veterinary medicine. It underscores the importance of considering the interplay between different components of the blood and their impact on overall health and disease. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.